I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambakar in Santa Fe, New Mexico, explaining the SOUND and ENSEMA trials, which both demonstrated that women with breast cancer don't all need to have sentinel lymph node biopsies, and why someone might still choose to have a sentinel lymph node biopsy done despite the data and what it showed. So both of those studies showed that the risk of the cancer coming back in the lymph nodes was very similar in the group of women who chose to have lymph nodes removed and in the group of women who chose not to have lymph nodes removed. And this was studied only in women who were undergoing lumpectomies, not mastectomies, and all of the women underwent radiation. This is an ultrasound of the lymph nodes under the arm or in the axilla, which shows a perfectly normal lymph node. You can see that the cortex, which is this thin black stripe, is very thin, which is normal. Meanwhile, this is an ultrasound of an abnormal looking lymph node. The black stripe is much thicker, and that's what gives radiologists the clue that this is a lymph node that needs a biopsy. According to this study, the negative predictive value of ultrasound is 92%, which means that if you have a lymph node that looks like this on an ultrasound, there is a 92% chance that it does not have cancer in it, which means there's an 8% chance that there could be a cancer hiding in this lymph node that was missed by the ultrasound. So when I discuss the data about the SOUND and ENSEMA trials with my patients, sometimes some of them say, well, 92% is not good enough, and I would rather be 100% certain that there's no cancer in my lymph nodes. And that is reasonable for anyone who feels like they'll worry about it all the time if they don't know for sure. But doing a sentinel lymph node biopsy does come with risks as well. Doing more surgery always comes with more risk of complications, but in general, doing surgery in this area under the arm means that there could be numbness under the arm that persists for months. There could be something called cording. There could be a chance of an infection, and there's also a very low chance of lymphedema or permanent irreversible arm swelling. I've presented this data to a number of my patients who are all above 50, have smaller than 2 centimeter cancers, don't have any other spots of cancer in the breast, and who have grade 1 and grade 2 tumors. And most of them do choose not to have lymph nodes removed, but there are a few that say, I'm worried about that 8% chance that there's cancer hiding in my lymph nodes that was missed by the ultrasound, and I would rather just have you remove them. And that's okay too.